Hi, I'm Laura and I'm a doctor in Oldham, and thank you so much for coming on this training. We hope that by the end of this you will feel confident to go and talk to people about COVID-19. As you know, COVID-19 cases have risen massively in Oldham in the last couple of weeks, and what's concerning is that it's in all parts of our borough and it's in every age group. In some parts of Oldham, COVID-19 cases now are higher than when Leicester was put into full lockdown. We really want to avoid a full lockdown because the impact is huge, and so we're asking everyone to do their bit to stop that happening. We don't want to go back to March when our hospitals were full of people sick with COVID and many of us lost loved ones. So let's all start now. Oldham is doing 3 things to tackle COVID-19. The first one is we're having lots of conversations with lots of different people about how we can stop the spread. The second thing is we're supporting people who test positive so they can isolate and not spread the disease further. And thirdly, we're increasing our testing so we can find out where COVID-19 is and then support people in isolating. So, for a bit of science to start with, just a refresher. COVID-19 is a virus. This means that antibiotics will not work. The virus first appeared in the world, we think, in December 2019, and it was from China. However, it spread around the world very quickly. It's very contagious and it's quite easy to pick up. It spreads by somebody coughing or sneezing droplets onto surfaces and then another person touching those surfaces and then touching their mouth or face. It also seems to spread and linger in the air, but the evidence for this is very new. There are lots of things we can do to stop the spread of COVID-19, and so these are the things that we're asking you to do. The first thing is keep your distance. We really need people to keep a distance of 2 metres. 2 metres means that the breath and the talking that I'm doing will not reach you. 2 metres is a safe distance. If we ask people to take 2 metres apart, we know that basically most people do about 1 metre. We're not very good at judging distance. If we ask people to stay 1 metre apart, they basically do 1 foot. So we're going for 2 metres at all times. The second thing we're asking everyone to do is to wear a face covering. They don't have to be fancy. You might have bought one off the internet already. This is mine and I quite like it. It's quite comfortable. Or you can use a simple face cloth, cloth that you can cover your face with. Or if you wear a headscarf, you can just put that over your face. However, your face mask or face covering must cover your nose and your mouth. We know that they're a little bit uncomfortable. However, if your nose is popping out, all the air that comes out of your nose still contains the virus. And worst of all, if your mask or face covering is on your chin, the only thing that's being protected from COVID is your chin, and it's not very effective. So please wear a face covering. We're asking you not to use the surgical masks that you can buy because we need to keep those for hospitals, for doctors and nurses and cleaners and porters and radiographers and everyone that works in our healthcare system and social care, all the people who look after people in care homes. We need to keep these for them. So for the rest of us, when we're going about our day-to-day life in shops, in pubs, in takeaways, on the bus, anywhere there's other people, we're going to wear a face covering. Wearing a face covering shows that I am protecting you if I carry the virus, and you are protecting me if you carry the virus. So it's a very good sign of respect. The third thing we're going to do is we're all going to get really obsessed with washing our hands. Please use soap and wash your hands correctly every time you leave the house, get in a vehicle, change the car, eat some food, go to the toilet. We want you to be washing your hands a lot. Washing your hands means the virus isn't lingering on your hands and then you can put it into your mouth. You can use hand sanitizer when you're out and about, and there's lots to buy now in the supermarkets and shops. But remember, hand sanitizer is not as good as soap. The final thing we're asking everyone to do in Oldham is not to mix households. I love seeing my friends and family. I really enjoy it. And it's been one of the hardest things about COVID-19. The thing about households is that if one person in a household gets the virus, it's very likely that everyone else who lives there will also get it. And that's because we all share a lot of common spaces, bathrooms, kitchens, bedrooms, playrooms, living rooms. We all live together, we're likely to get it. And so if you've got households mixing, that means that the chance of transmission between both households is high. So if you've got 4 people living in a house and 1 person tests positive, 4 people are likely to get COVID. If you've got 10 people living in a house and 1 person gets COVID, it's likely that 10 people will get COVID. However, if 1 person from that house meets another house of 10 people, you could have 20 people getting COVID. And we think this is part of what is going on in Oldham, that we're sociable, friendly people who are curious about what's going on in other people's lives, and we are mixing. We might be mixing because of childcare, we might be mixing because we're bored, we might be mixing because, quite frankly, we've had enough of all this. Please, 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 for the next couple of weeks, don't mix households. It allows us to put a little bit of a firewall around it, so if one household gets it, no one else will get it. There's lots of ways to keep in touch: the phone, Skype, WhatsApp, FaceTime, waving over the fence, all fine. Just don't mix your households. And the final thing is testing. Now, there's lots of rumours about testing. First of all, the test is not 100% accurate, and we all know that. Secondly, having a test and getting a positive result means you actually have got COVID. So you need to isolate for 10 days from the date of your first symptom or the date of the test. And everybody, and that's everybody you live with, has to isolate for 14 days. Now, we are doing lots and lots of testing in Oldham. The reason we're testing is to find out who has the disease. For those of you clever people out there who say, well, if the government are counting the number of positive tests, what we need to do to avoid a lockdown is just stop testing people. Unfortunately, it's not that simple. First of all, not testing people does not mean the virus isn't there. It just means we don't know about it, which is actually more dangerous. And secondly, we look at other things alongside the number of positive tests, one of them being the positivity rate. We know that if we tested 100 people and 1 person had COVID, that the disease is likely to be not very common in our community. If we test 100 people and 6 or 7 or 8 or 9 or even 20 people come back positive, we know there's a lot of disease. So, for instance, hopefully in a couple of weeks' time, we will test 500 people a day, 1,000 people a day, and we will only get a handful of positive tests. That's when we know that we're getting on top of this disease. Getting a test is really easy. There are 3 ways to do it in Oldham. First of all, you can go on the government website and you can book one. They're totally free, completely free to anybody, everybody, whether you are here under a passport, a visa, whether you've lived through your life, however you are here, you can have a COVID test for free. Secondly, you can ring 119 and somebody will answer the phone and they should be able to book you a test. And the third way is that in the next couple of weeks in Oldham, there will be lots of pop-up testing and you can book in there. So there's no shortage of testing. And the final bit is that obviously we are going street to street and door to door to test in areas that might have lots of disease. And that's where this community engagement comes in. So that was a whistle-stop tour of the lessons. What we want you to do is go out as part of a team and have lots of community conversations. There are certain things we want you to remember about this. First of all, please don't get into argument with people. It never ends well. We are doing this because we want to bring behaviour change. We don't have to win the argument. We don't have to prove we're the cleverest. We just want to install in people simple behaviour change. So, we know you're all really good at communication, but here is a few gentle top tips. First of all, when you go and meet somebody or knock on the door, please introduce yourself. So I would say, hi, I'm Laura and I work for the NHS. I've come today to talk about COVID. So make sure people know your actual name. Wear an ID badge of some description, whatever agency you're part of, wear your badge. And the next thing we're going to do is ask a really open question. A nice open question is, have you heard that COVID cases in Oldham are rising? Now, you're going to pause and listen. Listening is really important. When we listen to people, we find out what they really think. So they might come back and say, oh, I saw it on Facebook, or I heard it on the news, or my neighbour was talking about it, isn't it awful? Or they might say, well, it's all a conspiracy theory, isn't it really? So by asking that question, you know where they are in this spectrum. We want to have a dialogue with people. We're not there to just ram information down their throat. We're going to have a dialogue with them. Hopefully you'll have some face coverings to hand out for free, which is a nice little carrot to start the conversation. So, we want you to talk to them about how to stay safe with COVID. Remember the things: keep your distance, wash your hands, wear a face covering, don't mix households, and get a test. Okay, those are the 5 things that we're all going to learn to do. So, as you have your conversation, you will be directing people. We know from what's happened already on the ground that most people end up in a conversation about testing really early on. But remember, testing is just one part of our conversation. We really want to have a conversation about the other things. So, hand washing, face coverings, distancing, not mixing households are all important. There's no point testing everybody if everybody carries on behaving like they normally do and spread the virus everywhere. We need to get on top of it. And the final thing is to talk about what people do when they get a positive test. So, a positive test we know can be really upsetting. First of all, it's quite tricky to isolate, and so people will need help. In Oldham, we've set up a support hub so that people can get help. This help includes organising food deliveries, access to medication. It can be in befriending support if people are living alone so they don't get lonely. It can be welfare checks on them. And it can also mean support through financial micro grants for people who won't get paid whilst they are isolating. We really hope that by taking this stress off people, they will feel more able to isolate. The number is on the screen, and please make sure that everybody knows about this support package. You might find yourself having a conversation with some of our shopkeepers or takeaways or taxi drivers, people in business. This is a really difficult time for them, and we know they are really worried about their business. What we're asking shops to do is to do all they can to stop the spread. We're supporting them with things that we can get them signage, we can give them some face coverings to hand out, but what we want them to do is to model best practice for their staff and for their customers. So we want them to be wearing face coverings, we want them to be wearing face shields, we want them to be keeping their distance, and we want them to be washing their hands a lot. We know that people who come into contact with lots of other people are at higher risk themselves of getting COVID. So it's important that in these public spaces we all do our best. As you go about our community, you will be told lots of things. Some of them true, some of them not so true. Oldham, after all, is a hot pot of gossip and a hot pot of information. There are some things that we keep coming up commonly that we want to give you the answers on, in case you're asked. First of all, is the hospital safe? Yes, the hospital is very safe. It has completely divided itself into COVID and non-COVID, and so as you go into hospital, 1, everybody admitted is tested, and 2, the whole place is sparkling clean. This combined with the zoning means it's a very safe place to work. The staff in hospital have been working with COVID now for many months. They are experts in putting on all the PPE and getting it off quickly, and they know how to look after people without spreading this disease. So the hospital is very safe. Number 2, we get asked a lot, if I get COVID, will I die? Most people will not be ill from COVID. Remember, for most people, COVID is still a mild illness, that they get some unpleasant symptoms, but they recover on their own. A small number of people need support, and often this is done from a GP, and then a smaller number still need support in hospital, and a tiny number have to get really sick and end up needing further support. The thing about it is, as a doctor, it's always easier to treat people the earlier they seek help. And so if people are worried, they need to contact medical services. We are more than happy to come and assess you and see if you need support. And if you do, you will be admitted to hospital if needed, and the hospital will give you the 5-star treatment. We are so proud of our colleagues that work in our local hospital. Other questions I've been asked when we've been out and about: when is a vaccine coming? Who knows? Hopefully soon. The government are putting lots of money into vaccines, and there are loads of boffins inventing vaccines. We haven't ever invented a corona vaccine before, so it is a tricky one to crack. However, all the best scientists from all over the world are working on this, and they are really hopeful that a vaccine will be found soon. However, it's unlikely that any of us will be vaccinated before this winter, and that's why our basics are even more important. The final thing that we are being asked about is that all of us in the council and in the NHS do actually want a lockdown. I can tell you categorically this is not true. Personally, I hated lockdown. It was dull, it was repetitive, and quite frankly, I need to see humans other than the ones that I live with. So none of us want a lockdown. We really want the best for our town, and really want to work hard so that doesn't happen. So there's no conspiracy theory here. We are doing our best and working round the clock and at the weekends to make sure that Oldham has the best chance of possible of not going into lockdown. It would be really tricky for the town and the area. So that's why you're here, to help us all do our bit and spread the word. So remember, go out into the community, have fun, wear your high-vis jackets, wear your badges, make sure you know who your team leader is, swap phone numbers so you can get help. Don't stray off down roads that nobody knows you're about. Don't get into arguments. We're there to give information and to support people. And if you see anybody that is in desperate need or a situation that you're worried about, make sure you tell your team leader so that we can escalate and get support to them in our usual measures. It's going to be good. Last time I went on community engagement, it was an absolute hoot and I had a ball. If it's sunny, take your sun cream. If it's pouring with rain, take your umbrella. But thank you so much for everything you're doing. This is our best chance. This is what we need to do. Do the basics and we will save lives. We will help our town, we will support our community, and we will stop many people suffering. So thank you. Thank you. Do your best. Be smiley, be engaging, remember the basics. Keep a distance. Wear a face covering. Wash your hands. Don't mix households, and if needed, get a test. Thank you.